info session on NUGHI, or the Northeastern University Global Health Initiative, where we will give you an overview of who we are, some of our past conferences, and other events that we've also taken part in. So the Northeastern University Global Health Initiative is an organization on campus that is dedicated to educate undergraduates in global health related topics. We really try to bridge the gap between students and experts in the global health field by hosting a wide variety of fireside chats and panel discussions, as you've seen today. And we truly try to advocate for interdisciplinary global health discussion and education, as we do through our multiple workshop sessions where we target various sectors of global health, such as business and media, and really give a holistic view of ways to create change in the field. And we also, again, are known for facilitating Northeastern University's connections with global health experts in the Boston area through our conferences. Next slide, please. So I wanted to take this opportunity for everyone to get the chance to meet the rest of the team. For those of us on the call today, I will just ask you to share your name and your role, and then we can talk about some of the projects that we do. So my name is Fatima Muqaddam, and I am the conference director of the Northeastern University Global Health Initiative, and I'm primarily in charge of organizing our annual conference and getting speakers and coordinating the different aspects that go into it.
Yep, I can go next. My name is Niall. I'm acting as the club's director of finance. I'm mostly responsible for handling the logistics behind the conference itself, helping Fatima and Andrew out with contacting speakers, drafting questions, securing grants for the conference. And yeah, that's pretty much my role.
Hi, I'm Becky, or Rebecca Gluck. I'm our service and social chair. And in this position, I've worked throughout the year with both the conference team and our club team to run fundraisers, as we have throughout the year, for Black Women's Health Imperative and other organizations working on really important health issues. And we've also done some service events in person with ABCD Health Services and some other initiatives.
Hi, my name's Andrew, and I'm the Vice Director of the Northeastern Global Health Initiative. And so I work with Fatima and Niall to prepare this conference and other events we might have. And I think one of my favorite parts about NUGHI is the sort of open environment that we have, that students are always encouraged to share and engage with their own ideas, and everyone's willing to support them and help them bring that to life. And so yeah.
Hi, my name is Lily, and I'm the communication chair of NUGHI. I would say mainly I work obviously in communication, so a lot of outreach, and then fundraising and social media work, which Becky also has been helping a lot with for the conference.
Is it my turn? Sorry. I'm Ramya. I'm the president of NUGHI. And I think my favorite part about NUGHI is just kind of centering marginalized populations that are otherwise usually left out of the conversation when it comes to issues of health, and all the events that we do, and the really amazing team that we have to have those discussions and hold events that support those populations.
Thanks, guys. I think we can move into speaking about some of our past conferences. Andrew, if you could talk about NUGHI 2018, that would be great. Maybe Andrew's not here right now. It's fine. So we actually held our first conference in 2018, and that was when we were just a bridge builder project under the Office of Undergraduate Research and Fellowships. And we wanted to really create this community and fill the need for an interdisciplinary global health organization. And we thought we could do this by creating a conference, and we did. where we had around 225 attendees with 30 speakers and 10 workshop sessions. Our keynote addresses included Dr. Peter Hotez and Dr. James Cusack. And this is kind of where we started as NUGHI. We weren't a club yet, and we're really just building this sense of community at Northeastern University through this conference. Yeah, next slide, please.
Yep, so I can talk a little bit about global health in a changing world. That was our second conference. It was mainly there to build partnerships across disciplines with speakers and attendees, much like what we're doing right now in CARE. Our main theme at this conference encompasses how people, planet, and technology are changing through a series of focused plenary sessions, which are essentially guided talks and lectures from leading faculty and leaders of global health. There were plenary sessions on topics such as forced migration, climate change, and disease. And we also covered topics such as emerging technologies, and those topics were covered through a series of corresponding research presentations. One of our main tenets for being NUGHI as well includes the sense of community, and we sought to maximize student engagement within this conference as well. In doing so, we held student-led poster sessions, as well as 8 highly active, interactive, outcome-driven workshops, and we touched on a variety of topics during these workshops, including sustainable business practices, infectious diseases, and maternal or infant health. These sessions were like the plenary sessions led by field experts, people on the ground, and they allowed students to connect with each other and these leaders. It sort of made global health on its own act as like an interactive group setting, and that's kind of the type of community NUGHI seeks to create. This was building off of our success in NUGHI 2018, and a lot of the information we took from NUGHI 2018 was put into the creation of global health in a changing world. In this conference, we had approximately 280 attendees, more than 40 speakers from all fields. And for the undergraduate population, we had a very diverse group from about 18 different academic majors. And we chose this topic of people, planet, and technology to discuss emerging health crises and Northeastern's increased involvement in global health. And I think that's all I have to speak about global health in a changing world.
So I'll talk a little bit about what the club side of NUGHI does on campus. And just to preface what Niall said and also what I'm about to say, if anyone is interested in getting involved in NUGHI, please visit our website, which is, I'm going to send it in the chat. Can someone send it in the chat? I'll send it in the chat after we're done. Because all of our events are still virtual. So even if you don't go to Northeastern, you're welcome to attend any of these fundraisers and panels that we host. So one of our biggest fundraisers was over last summer called Black Health Matters. It was a collaboration with 11 student organizations, a bunch of offices on campus, and we got over 500 donors from around the world to raise over $35,000 for 4 grassroots organizations dedicated to bettering Black health. And that was the Black Women's Health Imperative. And if you were here earlier, Janae Epps, she was a speaker from that beneficiary. The Center for Prisoner Health, which we have another speaker coming from that beneficiary later today. The Audre Lorde Project and ABCD Health Services, which, as Becky mentioned, we've continued to do service projects with them throughout last semester, and we're continuing to do so this semester. Niall, next slide. Thanks. So this is, the next few slides are just going to be examples of panels that we've hosted and really cool speakers that we've had. And one of the panels was a Palestinian health panel that was also last semester. And we talked about the toll that the Israeli occupation and other issues have taken on Palestinian health and wellness as a whole, specifically touching on mental health, access to healthcare, et cetera. And the speaker in the middle there, Dr. Bram Wispelwey, he's going to be a speaker at our panel talking about the effects of institutionalized discrimination on health outcomes later this afternoon. And all 3 of those speakers are incredible. They're activists and clinicians. It was a really cool panel that we hosted in collaboration with the Students for Justice in Palestine on campus here. Next slide.
So another one of our panels that we've held, this happened later in the summer, but at really the height of the pandemic. I would say that we're still in the height, but we held this panel, which included a doctor from UMass Memorial, and also we included a student from Northeastern who is on co-op working in ER. So it was really interesting to hear about their different experiences throughout the pandemic and really learn about like what we could do at that time to help the causes. Next slide. And then later in the semester, we held a panel with Dr. Ramai, who we heard from earlier, and Dr. Mark Dybel, who we also heard from yesterday. And this was for World AIDS Day. It was really interesting talk between them, talking about what AIDS has been like in the US as well as internationally, and how us as students, how we view that today, and how the world is kind of moving forward in those causes. Next slide.
So most recently we hosted Dr. Jonathan Butler because February was Black History Month and also Heart Health Month. So we hosted him to talk about the disparities in heart diseases across Black diverse populations, and specifically how cardiovascular disease disproportionately affects Black Americans. And he spoke about his work and just like what needs to be done going forward to address these issues. Next slide. And Janae Epps, who again from Black Women's Health Imperative, she spoke earlier. We talked about World Prematurity Day. We talked about how prematurity and maternal mortality disproportionately affects Black infants and Black mothers. Next slide. And we also had an Indigenous Populations Health panel last semester for Indigenous Populations Day, where we hosted activists and clinicians to discuss different facets of the health of Indigenous populations, the United States and Canada, and specifically looked at the impact of racism and COVID-19 on the current health statuses of Indigenous populations. And a speaker who will be at one of our panels later this afternoon actually works with the speaker who's seen on the screen there, Rexine Williams, and they both work for the COPE program in Navajo Nation. So they're both very, very cool. Thanks.
So as a whole, the Northeastern University Global Health Initiative team continues to plan these events centered around educating and discussing topics to advocate for the most vulnerable populations. And we believe that through hosting these discussions, we can create a generation of leaders with the knowledge to address these disparities to create a healthier, more equitable society for all. And I know that I joined NUGHI when I was, I think like in freshman year. I'm now fourth year, and it's been an incredible experience for me, especially learning about all of these disparities. I did not know as much coming into it, and I think that the group that we have here are some of my close friends now, and it's really nice to see that you can join an initiative to be to build that community. And I think maybe we can go around and just talk a little bit more about some of our personal experiences with NUGHI. And if you have any questions about the organization or the conference, please let us know in the chat or in the Q&A. Niall, do you want to go next?
I just want to take a minute or so to think or reflect, because I started at NUGHI going in between my second and third year. Around that summertime, I'm about to graduate right now, and I was and am on a pre-MD PhD track, and my prior work and background was very much digging deep into a lot of biochemistry and pathology on that aspect. And I haven't recently realized, but coming into NUGHI, I realized how immature that perspective was. As I was trying to become a physician, I did not really encompass or think about who I was trying to serve. And that's what sort of I got from my experience at NUGHI, listening to all these speakers, these wonderful panels, and these very interactive settings. It lets me know that, becoming or trying to become a physician is sort of something that requires more than just the books and knowledge. And here it's about knowing who you're trying to serve and being very cognizant about the language that you use. And through our discussions, Voices from the Front Line specifically, especially when we were talking about yesterday about in the workshops, including increasing accessibility and understanding of healthcare through like intelligent design of flyers and posters, all this information, when you synthesize it, essentially shows that there's a current deficit in how we treat and discuss health towards the people that we want to talk about. And this isn't something that I was able to understand on my own. And I'm very grateful to have a team with me that was able to sort of guide me on this journey of I guess, like enlightenment. That's a little bit too corny, but it's essentially something along those lines. It helps me become more aware of who I am in my position.
I can go next. So I joined NUGHI at the end of my freshman year after I attended the first conference. At the time, I really had no idea what I want to do in my career. I was a biology and political science major with a minor in health science. I was all over the place. I just knew that I wanted to do something about things that are happening around the world. But through NUGHI, I was really able to find find a community of people that really shared my passions, and also the network and the knowledge and the education and the exposure to really focus my interests and make a career of that. So for example, one of our former members, she used to do a lot of research in malaria, and she introduced me to a professor that I could also do research with, and since then I've been working in that lab for a couple of years now. And so yeah, for me it's really aside from the education, it's really about the mentorship, and it's not the mentorship, but really the relationships and the community that I feel has really supported me throughout my career. And so yeah, that's one.
I can go next. I think one thing that's really cool about NUGHI is the one-on-one kind of connection that you get to have with all these really cool speakers that we had just talked about. Like if you come to a fireside chat, you get to have a conversation with them that you might not be able to elsewhere. And NUGHI is also a great platform for activism because of our reach through the conferences that we host, and our collaboration with other student organizations on campus. We're able to mobilize so many people to fight for the populations productively that we're trying to assist in any way possible. So again, we are always open to new members, and I send our email address in the chat. So if you have any questions or want to get involved, you can reach out to that email address at any point.
Yeah, definitely join NUGHI. I joined coming off of going abroad actually for a global health co-op. I was in Uganda, and coming back, I really wanted to channel my learnings and kind of push myself to think further about a lot of the things that I'd experienced. And coming into NUGHI, and now I'm about to graduate. And when I really think back on my whole time at Northeastern, I think really the experiences and all the chats that I've been to have shaped my ideas about global health and kind of where I want to go. And I think as an undergrad specifically, you're not really given a lot of opportunities to engage with global health and think critically about all of these issues and topics that we discuss. And being with our e-board here and everyone that I've met has really, we push each other to think about different ways to approach issues. And I think just being a part of this organization has shaped all of us moving forward. So I really encourage anyone who is interested in global health or just health in general to get involved in any capacity that you can.
Is Lily here? Okay, that's fine. So thank you guys for telling us about your experiences. I know next, so if there are no questions or if you have questions later, again, feel free to email us in our globalhealthneu@gmail.com or go to our website, NUGHI.org. We do have some more research talks next, as well as 2 more workshop sessions for you guys. So our research talks will begin in about like 5-7 minutes. So stick around. We will have Dr. Magdalena Sabrowski, who will talk about the social determinants of health. And we'll also have Kimberly Mutcherson, who is co-dean and professor of law at Rutgers University, who will talk about racism and reproductive justice, which is actually a topic that we held a book club on over the summer, where we read Killing the Black Body. So really interesting topics coming up next for you guys. We hope you stick around to join us. Thanks.